Well, my friends, this is the case of a gentleman aged about 81 years, an old man. Pain and heaviness sensation in the abdomen, constipation, headache, pain and heaviness sensation in the abdomen. পেটের কোথায় অস্বস্তি দেখান? Around the epigastric region, left hypochondriac, left lumbar, and mostly at upper part. The CCT of whole abdomen reveals it is a case of neoplasm of the pancreas, malignant growth at the head of the pancreas with metastasis to liver. So CA of pancreas, metastasis to liver, for which many allopathic physicians are consulted. He went also at some homeopathic center, JC Regional Research Institute for Homeopathy, probably a central council conducted homeopathic center under the Ministry of Ayurveda. And they have prescribed Hydrastis 6, Carduus Mariana's mother, and that is followed by probably Hydrastis 30. There is no improvement of the patient. There is pain and heaviness sensation in the epigastric region. The patient has come to me. And the diagnosis is pancreatic C. Pancreatic C. Pancreas, you know, my friends, is a lip-like structure situated behind the stomach and in the mid portions of the loops of the duodenum. It acts both endocrine and exocrine gland. Acute pancreatitis is related to the acute damage of the pancreatic tissue, especially near its duct. The main symptom is epigastric pain. There is sudden, severe, agonizing, excruciating, continuous pain in the epigastric region, which radiates to the left side of the back, as if it tends pierce to the back or sometime to the left loin. In case of pancreatic CA, occurs usually at the head of the pancreas and rarely to the tail of the pancreas. Symptoms are more or less same like acute pancreatitis, but the carcinoma generally begins from the pancreatic duct and ends near the head of the pancreas. Males are more affected than women. This is of course a male subject. History of alcohol intake, smoking, and diabetes mellitus are the three exciting factors of pancreatic C. Of course, there may be have a genetic disposition for pancreatic C. Many patients are asymptomatic. Many patients are asymptomatic until an advanced stages when they present with central abdominal pain, weight loss, and obstructive jaundice, etc. This patient was more or less asymptomatic, recently developed pain. The pains are, of course, I have told you, the growing in nature and often radiates from upper abdomen to back. Like acute and chronic pancreatitis, pain aggravated when the patient lying down and may be caused by little bending forward. There is anorexia, loss of weight, and troublesome foul-smelling diarrhea. When there is metastasis, as our subject already metastasized in the liver, involvement of the common bile duct and liver are common, which causes pruritus over the skin and abdominal mass due to the tumor. A palpable abdominal mass over the epigastric region is found. However, the symptomatology corresponding to me prescribe Natramune because we treat the patient, not the disease. May it be a case of CA of the head of the pancreas, I do like to prescribe by symptom totality. And the symptom totality totally representing Natramune and not hydroxys or Cardus Mariana's mother. Because the physical makeup, lean, thin, emaciated patient, tremendous desire for salt, desire for bitter, the patient is chilly, gas is cold very easily, and the patient is also suffering from headache. So all symptoms go in favor of Natramune, constipation, headache, chilly patient, gas is cold very easily, cold tendency to take, desire for salt, desire for bitter, cold drinks, and the physical makeup indicates nothing but the sodium chloride. So I do like to prescribe sodium chloride or Natramune in 50 millisimolar scale of potencies with the direction thrice in a day, morning, noon, and evening. Let's see the result. I shall share with my friends. হুগলির কোথায় বাড়ি? সোনাইদহ, জনাই রোড, হুগলি জনাই রোড. So let's see the result. I shall share with my friends.